These are the examples of some drug I mentioned here, what we explained before. Now here, the decrease in the absorption of drug in the elder, and that leads to decrease in the plasma concentration. If there is a no absorption, the drug will not reach to the blood and decrease in the plasma concentration. So there is one drug I mentioned here, ketoconazole. These are the azole derivative and that are used in the treatment of fungal infections. These are antifungal drugs: ketoconazole, miconazole, iconazole, fluconazole. All azoles are antifungal drugs. This antifungal drug, ketoconazole, this is the acidic. The nature of this drug is acidic, and it need the acidic environment to be dissolved and absorbed. In elder person, the stomach pH become basic, and that's why acidic drug is not able to dissolve and not able to absorb. That's why decrease in the plasma concentration. This is one example. In elder, the drug absorbed by the active transport. What is active transport? Active transport needs the energy. They needs the ATP. But in elder person, there is decrease in the ATP production, altered membrane properties, and sodium potassium pump also altered. So in elder, the active transport is affected. Why? Due to absence of energy, and energy is due to by the ATP. So what is the effect? The drugs like iron, calcium, and
Accumulation
vitamin
iron,
B12.
calcium.
The drugs like iron, calcium, and vitamin B12, they need ATP, active transport, to be absorbed by the intestine, stomach. So which transport in the elderly is affected? Active, not passive, because active transport need the energy ATP, and ATP production in the elderly get decreased. That's why the elder person deficiency of iron, anemia, vitamin B12, anemia, calcium, osteoporosis. These are the issues. Another example, as we see now here, increase in the absorption. If the absorption of the drug is increased, the plasma concentration is also get increased. Now just we seen that the activity of metabolizing enzyme in elderly is decreased. These are the labor. If the number of labor is decreased, drug is not getting to metabolize. Remember, no metabolism, no excretion. No excretion. Where is the drug? Drug is in the body. And what is the effect? Repeated administration of the dose, drug build in the body, and that result to the toxicity due to increased plasma concentration of that drug. Leodopa, this is the drug that are used in treatment of Parkinson's disease. Parkinson's
Doctor,
is
can you
on the,
repeat?
pardon,
Sorry, can you repeat the last point?
this one?
Yes,
Yeah.
please.
The effect of metabolism in elder person. In elder person, the metabolizing enzymes are decreased. Metabolizing enzymes. These enzymes from the family of cytochrome P450, CYP. And these are important for the metabolism of the drug. But due to decrease in the metabolizing enzymes, we can say these are the labor. Labor for what? To get the metabolism of drug. If the metabolism is increased, sorry, if the metabolism is decreased, it means that why it is decreased? Due to number of labor is low. Number of labor is low. Number of enzymes are low. It means that no metabolism, no excretion. Excretion means from the body. The drug is not get excreted by the body. Where is the drug? Drug remains in the body. And repeated administration of dose, leodopa, daily dose, 2 times a day. Repeated administration of this dose that increase the plasma concentration because drug is not able to excrete or slowly excrete, and that may leads to toxicity. Leodopa is an drug used for the treatment of Parkinson's disease. Parkinson's is the neurological condition where patients have three symptoms: akinesia, rigidity, and tremor. Leodopa is a mainstay in the treatment of Parkinson's disease. So if we are giving the leodopa to the patient of the elder more than 65 year of age, we need to decrease the dose to avoid the toxicity. Why? Because the activity of metabolizing enzymes in the liver are low. Clear?
Yes, thank you.
Yes. Next one is bioavailability. Yes. Bioavailability means amount of drug that reaches the systemic circulation, means blood. Suppose we took uh, 500 milligram of Panadol, one tablet by oral route, how much it reaches to the blood out of 500 milligram? Suppose it reaches to the 20 milligram, so it is called as bioavailability. If the bioavailability of the drug is increased, the plasma concentration of the drug is increased. Example, suppose 500 milligram Panadol, we take 500 milligram Panadol, and all 500 milligram reaches to the blood plasma. It means that the plasma concentration of drug is higher, bioavailability of drug is higher. Same here, again the example of leodopa, as I mentioned, why the bioavailability is increased in case of the leodopa? When there is a metabolism, after metabolism, drug get
No
excreted,
excretion.
drug get excreted after the metabolism. Here, decrease in metabolism, decrease in the excretion, or no metabolism, no excretion. Where is the drug? Drug in the plasma. Increase the plasma concentration. Second one is example is propranolol. This drug is a beta blocker, non-selective alpha 1 plus, sorry, non-selective beta 1 plus beta 2 blocker. Now, uh, propranolol has first pass metabolism extensively. Remember, in elder, there is decrease in the first pass metabolism. Now, what is first pass metabolism?
Liver.
Yes. After the oral administration of the drug, that reaches to the portal circulation, means the liver, and it is metabolized in the liver, is called first pass metabolism. We can say checkpoint.